So my name is Julia Newton-Bishop and I'm Professor of Dermatology in Leeds. And I'm speaking to you today about the research that our group has been doing, first funded by the MRC, but more recently by the Leeds Hospitals Charity. Melanoma is the cancer we work on, and it's a form of skin cancer. But much of the work that we're doing could apply to many, many different forms of cancer, and we're working on immunology, so immune responses to cancer. And melanoma in particular seems to prompt a strong immune response in many patients, but not all. In this study, the aim is to understand the immune response, and the first results we've had from this shows that we can see a signal in the blood that allows us to predict to some extent whether the patient will be fine with no further trouble or whether they will have further trouble. And this is exciting. And what we're doing now is trying to understand what this means in terms of the biology. What does it tell us about immune responses to cancer? Because if we can find why some people don't get an immune response, we can do something to boost that immune response. I've been talking about patients who are just newly diagnosed, but unfortunately, of course, a proportion of people do go on to have further trouble and melanoma comes back. And in the past, we had very little to offer for that. Well, now we have treatment, we have some immunotherapy, and what that does is it boosts the immune response so that the patient can overcome the melanoma. And this is wonderful treatment, but actually only about half the patients benefit. So we're taking the same approach, the same tests, and asking if we can predict who's going to benefit from the drugs or not, because if they're not going to benefit, they can try a different drug, one would hope, in the future particularly, and we can understand why there's this failure to respond. And this is a very important aim, and we're very grateful to our funders for allowing us to address it.